Good morning and good afternoon to journalists who are joining us for this background briefing on the 73rd session of the Regional Committee for the Western Pacific, as well as an update on COVID-19 in the region. My name's Olivia Law-Davies. I'm the Communications Manager for WHO in the Western Pacific region, and I'll be moderating the media briefing this morning. We're going to start with some remarks from Dr. Corinne Capuano, who's the Director of Program Management for WHO in the Western Pacific, and that'll be followed by the update on COVID-19 as usual from Dr. Babatunde Oluwakure, our Director of Health Security and Emergencies. Also joining us today, we have the directors of the technical divisions in the Western Pacific region who are going to be very happy to answer questions that you have on the important technical agenda items being addressed by the Regional Committee next week. So we've received quite a lot of questions already. We'll get to as many as we can. If there are additional questions from journalists who are connected live today, you can of course put those in the chat and we will get to as many as we can in the time available. So let's start now with some opening remarks from Dr. Capuano.
Thank you very much, Liv, and good morning or good afternoon to journalists across the region. Thank you for joining us for a background briefing on the 73rd session of the Regional Committee for the Western Pacific, which is taking place next week. Made up of ministers of health and senior representatives from 37 countries and areas across Asia and the Pacific, our Regional Committee gathers each October. It is the World Health Organization's highest governing body in the Western Pacific region, which is home to a quarter of the people on Earth. This year, we are again holding the Regional Committee using a hybrid format. While many delegates are coming to Manila to participate in person, others for whom travel remains challenging will connect virtually from their capitals. They will discuss important health agenda and agree on actions to address them. The focus this year is on non-communicable disease prevention and control, mental health, cervical cancer, primary health care, and reaching the unreached. On each of these 5 topics, WHO is proposing a framework for action for consideration by the region's health leaders. All of the frameworks have been developed over several years through consultation with governments, partners, and experts across the region. And they reflect the lessons and current context of the COVID-19 pandemic, knowing how it has impacted people's health and countries' capacity to provide services. The frameworks provide practical guidance for countries to build systems that meet the challenges of today and tomorrow. Before I go into more detail on each of these 5 agenda items that will be the focus of the 73rd session of the Regional Committee, I first would like to hand over to Dr. Babatunde Oluwakure, Director of Health Security and Emergencies in the region, to update you on the COVID-19 situation in the Western Pacific. Over to you, Babatunde.
Thank you very much, Dr. Capuano. Good morning, colleagues, members of the media. I'm going to give you a brief update on the current situation with COVID-19 in the region. And my next slide will show you the current global as well as the regional picture. And so you will see from the global situation on this slide that the number of cases that have been reported are of 622 million, with 6.5 million deaths. The situation in our region is 91 million with 274,000 deaths. The global trend, as well as the regional trend, is currently downward in terms of the number of cases that have been reported, and also mortality is also trending downward as well. But as we will see from the next few slides that I will show you, there is a little variation in both the region as well as globally. So when we look at the next slide, we have a number of our member states shown here as examples of those with a declining trend in cases. And as you can see, most of them have two surges, and that be the first surge being Delta, and the second surge or the second peak that you can see there being Omicron. And since Omicron, we have now seen a decline in cases. And this has been observed since the middle of August. As a result, member states are easing their public health and social measures, and they are doing this in a risk-based manner. And so therefore looking at taking a risk-based approach to the use of public health and social measures and adjusting them accordingly. There also is in these member states a relatively high vaccination coverage with COVID-19, which also allows them to use a variety of public health and social measures in concert. And I'll talk a little bit about that later on. In the next slide, what we can see are those countries, or a couple of our countries, who are experiencing an uptick in cases. And in particular in Singapore, what we can see is that the new recombinant COVID-19, known as XBB, is now becoming dominant and is causing an increase in the number of cases that are being reported from Singapore. And I will talk a little bit about the XBB recombinant in a little bit later in the presentation. But in New Zealand, we are seeing an increase in the number of cases reported there. But again, they have the BA.5 subvariant, which is the most common one in the region, but they are now potentially experiencing a new sublineage known as BQ1.1, but at the moment we don't have any detail in terms of the growth advantage, but there is an increase in the number of cases being reported in New Zealand. And again, both of these member states, you will note, have high vaccination coverage with the COVID-19 vaccines. The next slide shows, just to illustrate for you, the risk that we have. Of course, we focus on COVID-19, but we should also recall that a number of our member states have what we might term winter, and they are all now experiencing or seeing or projecting an increase in influenza cases in their countries. And this contrasts with the previous seasons that we have seen, where we have had either little or no cases of influenza while COVID-19 has been ongoing. And so as we are seeing the easing of the public health and social measures, a number of the countries are experiencing these increases in influenza cases. And if you look at the figure on the right, this is just using Australia as an example, and the solid red line represents the number of confirmed influenza cases reported in 2022, and the dotted lines are previous years, 2017, 2018, 2019, and 2021 and 2020 are so low you really can't see them on the figure. And so, of course, we continue to advocate for preparedness, including risk communication, increasing vaccination uptake, particularly amongst those most at risk, and that would be, of course, the elderly, the hard-to-reach populations, as well as healthcare workers and frontline staff, in order to protect them. And so that is both using the influenza vaccine as well as the COVID-19 vaccine. Now, if we move to the next slide is just to give you an idea of what are the predominant subvariants of COVID-19 in the region. If you look at the table on the right, you can see clearly Omicron present in all our member states. And BA.5 and XXB to the far right BA.5 is almost in every member state, and XBB is also increasing its presence in the region. The XBB is what we would call a recombinant variant. And these recombinant variants are usually derived from a combination of two strains. And in this case, as you can see, it's as a combination of B2.75 and BA.2.10.1. What we know at the moment is that there is increased transmissibility of XBB, and this is really seen in Singapore. We've got reports that it is now 54% of the most recent cases from Singapore have been reported as XBB. And also there is potential for increased hospitalization, but severity, we are not seeing signs of increased severity at this time. However, experimental data suggests that there is XBB has an increased capacity to evade antibody protection. I will now move to my last slide and just give you some takeaway messages. As we have seen, there is a decline in the number of reported cases, both regionally and globally. However, this does not mean that we should relax. As we can see, there's continued circulation of the virus, both within the region and globally. And as long as this is the case, we all remain at risk and the pandemic is not yet over. The co-circulation of COVID-19 along with other respiratory viruses, including influenza virus, suggests that there may potentially be an additional burden to the healthcare systems as well as social systems and so on. And so therefore, again, taking protection using vaccination of influenza vaccination as well as COVID-19 vaccines is very, very important. And as you will see there, we recommend the continued approach, excuse me, to protect high-risk populations and health systems. And member states are encouraged to take a risk-based approach. And this should not just be at national level, but also at subnational as well as local level and individuals. And so everybody should really exercise their risk assessment or in terms of how they protect themselves, protect their families, and protect their communities. And we use a combination of 5 key tools and vaccination, public health and social measures, health system capacity, early detection and targeted response, including the use of genomic sequencing, which allows us to identify which subvariants or strains may potentially be of concern, as well as using risk-based international border measures. And the use of multi-source surveillance supports our risk assessments, and so taking using multiple surveillance systems in order to determine what is actually happening on the ground helps us to determine what sort of risk may be threatening the population that we are trying to protect. And strategic communications, of course, very, very important in terms of tackling infodemics, providing information to communities so that they are empowered, as well as building trust with communities by providing information that is timely, that is appropriate, and that is contextualized for their needs. So thank you very much. Dr. Kapuano, back to you.
Thank you very much, Babatunde, for the presentation. As I mentioned earlier, the regional committee will address 5 big issues that affect the health and well-being of people in our region, and it will take stock of progress towards achieving our shared vision for the future to make this the safest and healthiest region. First, member states will consider the regional action framework for non-communicable disease prevention and control. The 4 big non-communicable diseases, or NCDs, that is diabetes, cardiovascular disease, cancer, and chronic respiratory diseases, already account for nearly 9 out of 10 deaths in the Western Pacific region. And if we don't step up action to address them, the burden of NCDs will keep growing along with their health, social, and economic impact. And this burden is not shared equally. People with low incomes are at higher risk of developing NCDs, and they have more difficulty accessing health services to manage them. We need to improve our systems, create health-enabling environments, and invest in NCD prevention and control. Each dollar invested can yield a return of $7. The framework countries are considering next week provides a pragmatic, cross-sectoral approach which builds on existing capacities, strengths, and initiatives, and it should help them to adopt new solutions to the NCD epidemic. Second, the delegates will consider the regional frameworks on the future of primary health care. Primary health care is a whole of society approach to effectively organize and strengthen systems so that they bring health and well-being services closer to communities. But with rapidly aging population, a growing burden of NCDs, and health security risks, primary healthcare systems in the region are challenged. Countries are grappling with health workforce shortages, and many people face barriers to accessing primary healthcare services due to their cost, location, or social and cultural factors. Primary healthcare needs to be fit for today and for the future. We need systems that not only treat people when they become ill, but that interact with them throughout their life to keep them healthy. The framework being considered next week should help countries to make smart investments and build primary healthcare systems that bring quality services to communities and empower and enable them to improve their health. Third is the regional framework for reaching the enriched in the Western Pacific. In every country, there are groups of people who are enriched by health systems. And during the pandemic, inequalities have widened. Many of them who were disadvantaged have become worse off. As countries build back better, they can use the framework being considered next week to transform health systems so that they reach the enriched. This will deliver significant returns for those people and enable a robust response to future health emergencies. The fourth item that member states will consider is a regional strategic framework for the comprehensive prevention and control of cervical cancer. No woman should die from cervical cancer, a preventable and curable disease. But sadly, 1 in 4 women in the world with cervical cancer lives in this region. Through the framework being considered next week, WHO will help countries to step up vaccination against HPV, which causes almost all cases of cervical cancer, increase coverage of cervical cancer screening, and ensure access to timely and quality treatment. The final item that member states will consider is a regional framework for the future of mental health. More than 200 million people in the Western Pacific suffer from a mental health condition. Yet, current approaches leave too many without access to essential services and support. COVID-19 has also impacted mental health and well-being, making existing challenges worse, while exposing many people to protracted stress and difficulty. The framework being considered next week should help countries to refocus their mental health agenda to include well-being and reach the enriched. It will guide them to transform mental health support into a community-based ecosystem of health and social services, and embed mental health into daily life with communities at the center. I'd like to finish now, so we have plenty of time to take your questions on these important agenda items. So I will stop here and give the floor back to you, Liv. Thank you very much.
Thank you so much, Dr. Capuano and Dr. Oluwakure, for those opening remarks and the presentation. We now are moving to the Q&A portion of today's briefing. So as I mentioned at the beginning, if you still have questions that you'd like to ask, you can pop those in the chat. But we do have a long list of questions already that we will try to get to in the time that remains. Let's start with some questions from Marianne Benitez at the Standard Hong Kong. One on cervical cancer to begin with. How serious is cervical cancer in terms of incidence, mortality across Asia, And what's the trend in the last 5 years? What can be done to help prevent? And is there a cure? What are the guidelines for women in Asia on doing regular pap smears? And are incidence and mortality related to race? And if so, how? I'm going to ask Dr. Tran to respond to this one. Over to you.
Thank you very much, Liv. Good morning, good afternoon to media representative. Thank you for the question. As Dr. Capuano has already mentioned in her opening remarks, next week we will be discussing a framework that aims to eliminate cervical cancer. 1 in 4 women with cervical cancer live in the Western Pacific region. The rate of cervical cancer are going up. In 2018, there was 142,000 new cases. This rose to 146,000 in 2020. In 2018, 64,000 women died, and in 2020, 75,000 women died. We are also concerned about the negative impact of the pandemic on HPV vaccine coverage, which dropped globally in 2020 for the first time. We need to increase vaccination and help girls who are still within the recommended target age catch up on this protection. Cervical cancer can be prevented and cured with highly effective HPV vaccines and cervical screening, and access to timely and quality treatment is essential. But currently, these strategies are not uniformly applied across the region. Differences in cervical cancer death by ethnicity are largely the result of inequities. Most cervical cancer deaths take place in low and low-middle income countries, where the access to public health is limited and screening and treatment for the disease has not been widely implemented. The disease is not genetically associated, but rather it is the discrepancy in access to healthcare service and social determinants that affect health. WHO encouraged countries to continue to use HPV tests for cervical cancer screening as is simpler, prevent more pre-cancer, and save more lives. We also advise countries to continue to use the current method, pap smear, which are still very effective, while gradually building capacity into transition into using HPV testing. The screening should start from 35 years of age and again by 45 years of age. For the women with HIV, the screening age starting from 25 and take place every 3 to 5 years. Next week, member states will consider the framework on comprehensive prevention and control of cervical cancer to accelerate our efforts to eliminate cervical cancer. No women should die from cervical cancer. Thank you very much. Back to you, Liv.
Thank you so much, Dr. Chan. Another question from Marianne Benitez, this time about COVID. With China sticking to a zero COVID strategy, how confident is WHO in ending the pandemic once and for all? Should people be told that COVID will become endemic and is here to stay because of the failure of stopping the pandemic? And regular vaccination might be the answer, like seasonal flu. I'm going to hand over to Dr. Oluwakure for this one.
Thank you very much for the question. China, as we know, like other countries, is making its own judgments based on its unique circumstances and measures that work best to save lives, prevent health systems from becoming overwhelmed, and minimize social and economic disruption. As WHO's Director General said last month, and I quote, "We have never been in a better position to end the pandemic. We are not there yet, but the end is in sight. If we don't take this opportunity now, we could run the risk of more variants, more deaths, more disruption, and more uncertainty," end quote. Currently, WHO does not have a mechanism for declaring or ending a pandemic, but we do have a system to raise the alarm when there is a public health emergency of international concern, as we are now, the situation we are now in with COVID-19. And this was declared by the WHO Director General on the advice of the Emergency Committee in January 2020. We have a global strategic preparedness and response plan to end the emergency of COVID-19. And the goal in that plan was that the emergency was envisaged to end by 2022. However, we are not quite there yet. The virus is here with us to stay, and we must live with it responsibly. Member states at national, subnational, and local level, as well as individuals, should use risk assessments to ensure that they are able to live responsibly with the virus. And this means, of course, maintaining the use of public health and social measures, which I mentioned earlier in my presentation, and particularly the use of vaccination, the potential use of social distancing, as well as the use of masks, in order for us to maintain and live safe and responsible lives. There was also a mention in the question around the need for annual doses of the COVID-19 vaccine. We are not yet at that stage where we have evidence of the need for this to occur. And so we would continue to advocate for people to finish their primary doses of COVID-19 vaccine, as well as to take the appropriate booster doses. Thank you very much.
Thanks so much, Dr. Oluwakure. We have a question from Teresa Montemayor from Philippine News Agency. She asks, where are we in terms of getting the upper hand against NCDs, non-communicable diseases? It seems like an insidious enemy. What can countries do to seriously address this? I'd like Dr. Okayasu to respond to that one, please.
Thank you very much. NCD prevention and control is indeed challenging because NCD are the result of multiple factors, including our genetics, our behaviors, and then our environment in which we live. Therefore, the new regional action framework for NCD aims to transform a disease treatment-centered sick system into a health system. That means society should create the health-enabling environment and then policies, while health systems should also support individuals to have healthy environments and then engage in self-care to facilitate longer, healthier, and more productive lives. Also, in addition to what needs to be done, we want to put more focus on how. That means each country should develop comprehensive plans tailored to their unique context, take more actions on the ground, and update their plan based on the feedback from the community. Thank you very much.
Thank you so much, Dr. Okuyasu. We have another question from PNA, this time on antibiotic resistance. Antibiotic resistance remains a huge threat. What's being done in terms of creating new antibiotics for existing and emerging antibiotic resistant pathogens? And how is WHO assisting in this regard? I'm going to hand over to Martin Taylor for a response on that one, please.
Good morning, good afternoon. Thank you very much, Liv, and thank you very much for the question on antimicrobial resistance. It's great that you're interested in this topic, and I hope that you can also join the side event on Wednesday of next week to observe the discussions on tackling antimicrobial resistance. Firstly, it's important for us to remember that our first line of work against antimicrobial resistance is to prevent further resistance developing as much as we can, which means reducing the unnecessary or the overuse of existing antibiotics. But your question is very important about the future pipelines. So in the Global Action Plan against antimicrobial resistance, the fifth pillar is explicitly about identifying investments, to have investments in new medicines, diagnostic tools, vaccines, and other interventions. And WHO works with a range of stakeholders globally to take forward this line of work. In particular, to give you a couple of examples, WHO works globally to identify the priority pathogens, those that are most dangerous, that are most risk, and develops a list of the most pathogens. So, for example, there is a list established in 2017 of the priority bacterial pathogens for which we need to urgently identify future products. And then later this month, there will also be a new list issued of the priority fungal pathogens, those that pose the greatest risk and threat. WHO also works to develop investment cases and work with other partners around pipelines for production and manufacture of these new antibiotics and antifungals. Thank you very much for the question.
Thanks so much for the response. Next, we have a question on climate change. Climate change seems irreversible. Has there been any progress in actions taken to protect the most vulnerable? For this one, let's go to Dr. Mark Jacobs, who is the Director of Pacific Technical Support over in Suva. He's connected with us via Zoom. Over to you, Mark.
Thanks very much for the question. So climate change, as I think we all very much understand, is a crucial issue for every country. But of course, there are some countries that are more vulnerable to many of its effects than others. And so potentially, or particularly for Pacific Island countries. I mean, they have the smallest carbon footprint, but they bear the biggest burden of many of the climate change impacts. And they face many challenges. So just a few examples is that they are, of course, very vulnerable to sea level rise. They are vulnerable to increased frequency and severity of severe weather events like cyclones, typhoons, and disruption to rainfall patterns. And of course, many of them have quite limited resources to actually tackle these challenges. And so supporting countries around our region, particularly supporting the Pacific countries, is really a major focus for us. And it's one of the 4 thematic priorities in our regional vision for the future. And certainly it's something that we are working very actively with Pacific Island countries on. So just some practical examples of the sorts of work that we're doing. Often in climate change, we talk about adaptation and mitigation. So adaptation is dealing with the impacts of climate change. Mitigation is trying to reduce the contribution to climate change. And we're working with countries on both of those things. So adaptation, we're supporting countries on things like strengthening disease surveillance and response, because there's many infectious diseases that have a climate change component to them. We're working with countries on improving access to quality water and better monitoring of water quality. We're working with countries on strengthening the resilience of healthcare facilities. And we're also working with countries to try to strengthen their capacity to deal with the health impacts of major weather events through things like strengthening emergency medical teams. But we're also working with the health sector in the countries that increasingly will be doing that to help them look at their own carbon footprints, their own contribution to climate change and how they can reduce that.
Prevalence of anxiety and depression increased by a massive 25%, with young people and women most affected. The explanation includes unprecedented stress caused by social isolation and constraints of people's ability to go to work, to office, to school, and the support from the loved one and from the communities. There is also an evidence of increased anxiety, depression, and self-harm among school-age children during the pandemic. With school closed for many weeks or longer, avenue for identifying and reporting mental health issues has been closed. When many people need support, the pandemic disrupted mental health and social services, not just for children and young adults. WHO have developed a range of technical resources and tools, conducted training and other capacity building activities enhance program planning and implementation, and launch high visibility campaigns. Many was developed specifically for vulnerable population, including young people. We are working with countries to ensure that mental health is fully integrated with COVID-19 response and recovery plans. The future of mental health must place people and communities at the center. Next week, member states at the regional committee will be endorsing the framework on the future of mental health that outlines the strategy to advance the mental health agenda grounded by a shared vision of the highest level of mental health and well-being for all. Thank you very much. Back to you, Lee.
Thanks so much, Dr. Tran. The next question that we have is from Marika Cinco with Kyoto News. She asks, may we please ask for an update on the status of Dr. Takeshi Kasai as Regional Director for the Western Pacific? If you may also please share with us an update on the investigation conducted with regard to accusations of racism and abuse. Moving forward, how will WHO in the Western Pacific region deal with this? I'm going to hand over to Dr. Capuano for this one.
Thank you very much, Liv. The process of investigations into the allegation made against the regional director is ongoing. Next week, on Monday, the 24th October in the morning, there will be a special session of the regional committee. During this session, the member states will be updated on the situation. After the special session of the regional committee on the same day, on Monday 24 at 2 p.m. Manila time, the 73rd session of the regional committee will open. And as I mentioned earlier, we'll consider a number of important agenda items, including the 5 technical agenda items I mentioned earlier. Thank you, Lee.
Thanks so much, Dr. Capuano. We have also some questions about the recombinant variants that were mentioned in the presentation by Dr. Olawokure a little earlier about COVID-19. We've got one from Catherine de Villa at Philippine Daily Inquirer and another one from Red Mendoza at the Manila Times. They're asking, is WHO aware of the so-called XBB and XBC variants, like the ones discovered in select countries in the region? Is WHO willing to tackle this issue of new variants head-on with other health ministers during the meetings next week? And what is WHO's projection of the COVID-19 trends in the region following detection in some member states of the recombinant XBB, which is initially found as immune evasive and highly transmissible? Over to you, Dr. Olawokure.
Thank you very much, Liv, for the question. Of course, very important and of current interest is these 2 new, or at least the new variants, as some people are calling them, but also these are what we call recombinants, and I explained that in the presentation. But all viruses, as we know, they always evolve and they continue to change over time, and this is what we are seeing with the COVID-19. Well, we are seeing with the virus that causes COVID-19, the SARS-CoV-2, and this is expected, and so we expect to see these new variants occurring over time, and they will continue to do so as long as the virus is present. So since June, the Omicron variant has been dominant globally and also within our region, and the sublineage BA.5 is the Omicron subvariant is dominant in this region, and we are also seeing an increasing number of cases of other subvariants as well as this recombinant XBB. And this recombinant is currently predominant in Singapore, but has also been reported from Australia, Japan, and the Philippines. The existing public health and social measures that we are all aware of, such as mask wearing, distancing, as well as ensuring that there is appropriate ventilation, all will help to suppress transmission of not only the SARS-CoV-2 virus, but also these subvariants as well as any recombinants. The use of vaccination is also, again, as I highlighted previously, very important as a means of preventing severe illness and death. Having said that, we must still remain vigilant. We must use the tools that we know work, and we must also ensure that we base our own individual risk assessment on the context within which we are in order to protect ourselves and our communities and our families. Thank you very much, Lee.
Thanks so much, Dr. Olrikure. We have a question now about primary health care, also coming from Red Mendoza at the Manila Times. This one is, countries are beginning to institutionalize primary healthcare services, whether part of their universal healthcare programs or a distinct service. What would WHO advise countries to further improve in their primary healthcare services, especially in countries where funding issues remain a key area for improvement? Over to you, Martin, for this one.
Thank you very much, Liv, and thank you very much for that excellent question on primary healthcare. So I think one of the really important things to bear in mind, and there's a framework on primary healthcare at the regional committee next week, is that primary healthcare is really at the core of the healthcare system. It's not a separate system, but it's at the core, and it's absolutely vital for our work across this region to achieve universal health coverage and make sure that everybody can access the healthcare they need at the time they need it, and without risk of financial problems. So in terms of making primary healthcare right at the core, it's part of resilient healthcare systems. It's part of our work to address the future challenges of non-communicable diseases and aging, and to enable healthcare systems to be financially sustainable and accessible for everybody. So the regional framework that we'll be discussing next week with member states on primary healthcare outlines 4 main areas of work for countries to consider when strengthening their primary healthcare. First is to develop locally adaptable and locally appropriate models for service delivery of primary healthcare. Second is to engage individuals and communities in the generation of their own health and their links with healthcare services. Third is to make sure that there's a health workforce in place ready to be able to deliver primary healthcare and also help patients access other care from hospitals or further away if and when needed. Fourthly is to make sure that there is appropriate finance in place with the right incentives. And then finally is to look at the broader context, the policies, the legislation, and the engagement with other sectors around water and sanitation and the environment and education to ensure that people can have that broader support for generating their own health. So those are some of the key recommendations in the framework on primary healthcare. Thank you.
Thank you so much, Martin. Now we have another question for Babatunde, this time on monkeypox. Monkeypox cases in the region seem to be declining or have disappeared. Is WHO still willing to advise countries in the region to procure vaccines for monkeypox to prevent possible outbreaks? Over to you, Babatunde.
Thank you very much for this question on monkeypox. So monkeypox, what we are seeing globally is a decline in cases of this particular disease, and also within our region, we have been we've only had a very small number of cases relative to the rest of the world, and particularly we are seeing these cases in the region of the Americas as well as in the region of Europe. Now, we have prior experience with the use of smallpox vaccines, and studies have shown that smallpox vaccines will have some protective effect against monkeypox. However, the supply of the vaccines for smallpox are very restricted and very limited at this time globally. And since the beginning of the outbreak, WHO has been in close contact with manufacturers and member states that have previously made their national stockpiles of smallpox available. And so we are looking potentially for donations. We've had some already. We're looking for further donations in the future, which may help to respond to this particular outbreak. Some countries are actually recommending vaccination for persons at risk, and this is healthcare workers or maybe identified close contacts. But in managing the response to monkeypox, vaccines should be considered an additional measure to complement primary public health interventions. So only people who are at risk, so as I've said earlier, those who have been in close contact of someone who has monkeypox, and this would include healthcare workers and their close contacts of the person infected. These are the ones who should be considered for vaccination. At this time, WHO does not recommend mass vaccination for the public, as this is not required in responding to this particular disease. Thank you very much, Liv.
Thanks very much, Babatunde. Now we have some questions from Rafael Vincent Bossano with ABS-CBN. He's asking, will bivalent vaccines also be donated to countries in the Western Pacific through the COVAX facility, bivalent to COVID-19, of course? Are there currently enough bivalent vaccines now that subvariants are being detected in countries? Over to Dr. Tran on this one.
Thank you very much, and thank you for the question. So currently, we do not have the data on whether the bivalent COVID-19 vaccine are more effective than existing vaccines that have been received WHO emergency use listing. So until supportive evidence on regulatory approval become available, the bivalent vaccine should not be used as the primary doses. So the highest public health priority remain achieving high and equitable rates of primary doses with the existing vaccine that have been granted the WHO emergency listing, especially for priority groups, and continue to administer booster dose for those people at high risk to prevent death and severe illness. So the countries should not delay the implementation of booster programs for first or second dose in the hope of securing the bivalent vaccines. WHO recommends that we should continue to use the own existing WHO EUL COVID-19 vaccine as the booster, since they continue to protect the people from the high risk of death and severe illness. WHO also recommends that people at the high risk of developing COVID-19 should continue to be prioritized and should not wait for the booster beyond 4 to 6 months after the primary doses. Thank you very much. Back to you, Liv.
Thank you so much, Wong. Now we have another COVID-19 question. While COVID-19 remains a public health emergency of international concern, some countries are already maintaining manageable levels. Is it advisable for countries to ease mask mandates, or in some cases completely forego them? Over to you, Babatunde.
Thank you very much, Liv. I think this is really a very, very important question. And one thing that we should understand is, of course, that the pandemic is not yet over, and the public health emergency of international concern is not yet over. So as such, every country needs to make its own judgment based on its unique circumstances on measures that work best to save lives and prevent health systems from being overwhelmed, as well as to minimize social and economic disruption. We have already outlined the various elements that are needed for sustainable management of COVID-19. And these include, once again, vaccinating the highest risk groups, maintaining strong surveillance testing and sequencing, ensuring early clinical care, and the targeted use of public health and social measures. And these is a group of measures. And so it's not just that use one and don't use others, but it's about using them all together in various ways in response to the situation. And this includes the isolation of cases, the use of masks, physical distancing, ventilation and cleaning of hands, as well as empowering communities with clear, open communication and tackling the infodemic that is happening in relation to COVID-19. what we have also noted, and albeit within a clinical setting, is that the Omicron variants tend to have what is called a higher immune escape, and may therefore evade antibodies from past infection or vaccination. And so it is very important, again, that we continue to use those measures to protect not only ourselves, but also to protect those who are most vulnerable and at risk of infection. Thank you very much, Liv.
Thanks so much, Babatunde. We also have a question from Karen Lima at Reuters. She asks, could you give us a walkthrough of next week's agenda? Will there be meetings that will be open for coverage? Will WHO share salient points of the regional frameworks mentioned during this morning's briefing on NCDs, cervical cancer, mental health with journalists? I can answer that one. Absolutely. The whole proceedings of the 73rd Regional Committee meeting for the Western Pacific taking place from Monday afternoon through to Friday afternoon next week will be live streamed here on our YouTube channel. We warmly encourage media who are connected today, as well as the public and anyone else who's watching this on our social media channels, to follow along. So you'll be able to watch all of the agenda items that were summarized today, as well as a series of side events, panel discussions, other important interventions, including a report on the work of the organization over the past year. We will also be sharing press releases on several of the days next week, links to other material, personal stories, fact sheets, and the like. So all of this to say there will be plenty of material that we will be sharing with you, summarizing all of these important health issues and the actions that countries in this region are taking to address them with WHO's support. And if you have any questions on any of that material, please do be in touch with us, and we'd be happy to help you on any of those follow-ups. I think that's actually all we have time for this morning. So I just want to thank everybody who's connected today and thank all of the panelists for all of their interventions. Next week promises to be a very packed and interesting agenda. And we look forward to seeing you all online and seeing the news stories that are going to go out to the region and help the people of the Western Pacific know what's going on and how they can best protect themselves and each other. Thank you very much.